So in the interest of time, we'll get going. I am Claire Neary. I'm with Rutgers School of Social Work Center for Prevention Science. I want to welcome you to this event, Uncovering What Does Not Work in Substance Misuse Prevention. And your trainer today is Chris Reed. I've known Chris Reed for a very long time. Chris has been in substance misuse prevention for over 30 years. She particularly works in practice and specifically in this gap between research and practice and making that gap smaller and doing the translation from research into practice. And so you're going to have a great session, I can tell you that. I want to bring Rebecca Alfaro, your Deputy Executive Director at CHCSA, to come on in and say a quick hello and welcome.
Thank you, Claire, and thank you, Chris, for coming back and doing another training for us. We're really so grateful for your expertise. We're able to do this with funding that was provided to us through the Department of Human Services, Division of Mental Health and Addiction Services, through a grant that they received from the federal government. So we're very thrilled to be able to contract with Rutgers and Claire and Kai, so that way we can bring this work to you. And one of the things that we had, as part of some of the trainings that we've done, there was a great video that Chris was part of that really talked about what very succinctly, like what doesn't work in prevention. And so it kind of really resonated with a lot of the work that we do and trying to really make that shift into working into quality effective prevention. And so we thought, what a great idea. Claire brought it to us that, we can bring Chris in to do this training. And we thought it was absolutely so relevant, especially as we're preparing for the next grant cycle, to kind of talk about what doesn't work and what are some of the things that we need to start phasing out. And then we're going to follow up with another training on what are some things that we can start phasing in. So I will turn it over to Chris, not to keep you all any longer. We have some really great content. So thanks.
Great.
Thank you,
Thanks,
Rebecca.
Rebecca and Claire. Thank you both. All right. So great to be here with you today. What I would love to start off with, if you don't mind, going ahead and putting in the chat an introduction of who you are, if you don't mind saying where you work and perhaps what hat you're wearing today. I know lots of people wear multiple hats in the prevention field. So if you wouldn't mind introducing yourself in the chat, I would love to see who's here. And as you are doing that, I'm going to give you a quick overview of what we're going to do today. So we are in the welcome and introduction part, as you might have guessed. We're going to take a step back and look at the big picture in terms of what are we doing in terms of the goal of prevention and really looking at our evidence-based, the information that we have for our field that is evidence-based. Then we will move into ineffective and effective prevention strategies and really looking at some of those details that we weren't able to get into with that video. So making sure that you have the information that you need to move forward around ineffective strategies in particular. And then last, we're going to wrap up with just a quick discussion around what are some of the barriers that can be exist in your community in terms of moving towards more effective strategies. All right, and a little warning, I'm going to have a few pop quizzes for you all as we're going along. That helps me understand how well I am imparting the information to you all. So just know that those will be coming up, that I'll throw a few your way as we go through this hour. All right, as I'm sure you all know, the prevention does take place before there's a problem. So I often like to, again, take a step back and think about how prevention exists in our broader world, not just in the substance misuse prevention field. So with sunscreen, we put on sunscreen in order to prevent a sunburn from happening, not taking care of a sunburn after it happens. Immunizations, we do immunizations before a disease ever occurs, not after, not to take care of it. It's not the treatment afterwards. Lighthouses, we want to prevent the shipwrecks, not take care of them afterwards. Virus protection on our computers. We have the different software that we can download to help prevent it from ever happening. So same thing with substance misuse. What we're wanting to do when we're focused on the prevention part of the continuum is we want to prevent it from ever happening in the first place. And to do that, we of course need to put measures in place before there's a problem. We need to move upstream. Many of you probably are familiar with the public health parable of talking about let's go upstream to figure out what's going on, um, instead of having to pull people out of the river who are drowning downstream. But of course, the question becomes, how can we do this? What kind of strategies can we implement in order to have that success, in order to move upstream? So as it says here, success depends on implementing effective strategies. So we want to make sure what we're doing, what we're putting in place that we believe is moving us upstream, really truly is moving us upstream. We do have a continuum of effectiveness. This is actually part of a graphic. It's a very detailed graphic from the Center for Disease Control and Prevention. But there's a continuum of evidence of effectiveness. There's everything from, as you'll see at the bottom, unsupported and harmful or ineffective strategies that we've seen through research are ineffective and sometimes harmful, to promising there in the middle, that there's some evidence of effectiveness, but perhaps the effect is undetermined. So this is the emerging area. There's this kind of this unknown. We don't know if it belongs to the ineffective part or to the effective part. And of course, the top right, there's the well-supported strategies that have been found to be effective, usually in multiple studies. There's usually typically longitudinal type of studies to really show that that strategy is effective. So for this session today, we are going to be focusing on these two areas. We're going to look at both the ineffective strategies, and then I'm going to give you a few examples of some well-supported or effective strategies for each category. All of this, of course, as I'm talking about these things today, they need to exist within a strategic plan in terms of knowing what needs exist within a community and how we can best address those strategies. Best address those needs. So with that, one of the strategic planning tools is the SPIF. I'm curious in the chat if you can put if you're familiar with the SPIF. I'm guessing many people are. If you could say yes or no in the chat, just so I can get an idea. Seeing one yes so far. What about the others? Yes, yes. Okay. That's what I was guessing, but I wanted to make sure I wasn't guessing and just assuming something. All right. So far, all yeses. Anybody else want to weigh in? Got a few more people here, maybe weigh in. Yes. All right. Okay. So far, it looks like everybody's familiar with this. Perfect. That's great. All right. So when we're thinking about the SPIF, the Strategic Prevention Framework, where does the program selection work get done in the SPIF? Where do you think? Go ahead and put it in the chat. Which steps of the SPIF, steps of the SPIF, do you think we do the work of selecting what strategies we're going to implement? Go ahead and put it in the chat, or feel free to unmute and say something too if you would like. What do you think? Anybody have an idea? Assessment. What else? Planning. Both of you are correct so far. What else? Are there any other steps where we are looking at program selection? Aha, Amber, you win the prize. Yes, all of them. Because all of this work together is what helps us identify which strategies we want to put in place, as well as whether or not they're working. So in assessment, that's where we identify what needs we have. That's going to help drive our strategy selection. Capacity, we need to know what resources we have to implement a strategy, and we need to know the readiness of the community. So it comes in at that phase. Of course, planning, which this is where really the crux of really getting down to, okay, which program are we going to select, happens. Of course, implementation, we are needing to monitor the implementation to see how it's going. And then evaluation, of course, we're going to evaluate the effectiveness of it. And then finally, as we all know, the overarching principles of sustainability and cultural competence need to be considered when we're looking at program selection. So well done. So when I'm talking about all this, I'm putting that the discussion that we're going to have today is in the context of doing some really good, solid strategic planning. All right, step 3 is what I talked about. That's where we're pulling a lot of the information together, and it's this second task within step 3 planning of selecting the effective evidence-based programs or strategies to be implemented. All right, so I'm hoping is helping set the stage for the rest of the information today. Any questions about that information before I move on? And we're going to actually have a pop quiz next. Any questions before we move into that quiz? All right, hearing none. Kai, could you please bring up this first pop quiz for us? It's going to appear as a poll for you all. If you can't use the poll for some reason, feel free to put your answer in the chat. So what is the most important reason that we implement effective evidence-based substance misuse prevention strategies? What do you think? Can folks see it? I'm not seeing anybody answering so far. Oh, there we go. All right, we have about half the folks have done it. A few more, looking for some more. All right, about 10 more seconds. All right, let's go ahead and end the poll and share the results, please. All right, so mixture of responses. What I was looking for here is to ensure we do no harm. So the most important reason, is to implement effective evidence-based substance misuse prevention strategies is to ensure we do no harm. Because what we find I see that the third one was selected quite often, that in terms of bolstering community support of our prevention, yes, we definitely want to do that. But that last part of the sentence of by delivering programs that are well liked, unfortunately, programs that are well liked does not always equate with effectiveness, because we find that a lot of programs and strategies that are well liked by communities are actually shown through research not to be effective, which is it's kind of frustrating, right? Because you're like, well, but we want to implement programs that are liked and strategies. Well, we can implement effective ones as well, but we want to make sure to start moving away from those that are ineffective. All right, we can stop sharing that now. All right, thanks for participating in that first quiz. Let's go ahead and move on. So let's get to the meat of this: effective and ineffective prevention strategies. What I would love for you to do is, during this part of the training, I want to make sure that you are not feeling any shame, guilt, or judgment from me or any others here, that if you are implementing some of these strategies that are shown to be ineffective, it's okay, because I guarantee you these things are happening across the country. Strategies that we know and we've known for years and years and years are ineffective are still being implemented. A big part of that is because trainings like this have not happened. And that's something it's become kind of my soapbox, is like, we need to share this information because this information is not getting out to folks. So please know, if you are implementing any of these strategies in your community, it's okay. This is the key piece, is to learn about it and know about it, and then start thinking about how we can move away over time away from ineffective strategies. So let's first look at the category of education strategies. There are 4 different areas within education that we know have been shown through research are not effective. And I want to point out on this slide, you'll see the the reference numbers, like assemblies is 8. What you have at the end of your slides, and hopefully we can send out these slides to you at the end if you haven't seen them already. Those are the references to the, the citations to the studies that have shown these things to be ineffective. And this information was pulled together in a lit review that we did last summer. And this lit review looked at all of the prevention science knowledge that we could find to show which strategies have been shown through research to not be effective. So this is all evidence-based information around what is not effective. I meant to say that before we got to this slide. All right, so education, assemblies. This is something so popular all across the nation. My guess is in New Jersey as well, is people love to do assemblies, school assemblies. For one thing, they're really easy to do. Just get all the kids in there and get them all sit there. We do an assembly, everybody hears it at once. It can feel really good. It can be really exciting at the moment. But we know is that there's not any lasting impact typically with these assemblies. So that is not a strategy that has been shown to be effective for substance misuse prevention. Secondly, I have personal testimonies here. So these are the kinds of things where somebody who's in recovery typically will come and give a talk about the impact of substance misuse or substance use disorder on their life and kind of the trajectory of what has happened and the impact, the negative impact, as well as coming into recovery. They will often talk about that. This is another one of those things that we're like, yeah, it feels like it should work. That yes, talking about this and how the negative impacts of this, that it's going to show kids that they should not be doing this, that it's going to have a negative impact. Unfortunately, in the brain, especially the teen brain, we know that we've seen that they're like, well, that happened to them, that would never happen to me. And I don't know about you. I have 2 boys who are now 19 and 22. But those words literally came out of my younger son's mouth when I was talking to him about something. He's like, well, that would never happen to me. And I just about, of course, burst out laughing because I was like, no, you actually aren't saying those words. But yes, I mean, they truly are not able to see that, yes, those things that other people have experienced can actually impact them. So while we think it might be a useful strategy, research has shown over and over again that those personnel testimonies are not effective. Thirdly, mock car crashes. Again, this is super popular, and it's usually during prom season that they'll put out the simulated car crash, and often we'll even have kids dressed up in their prom dresses and blood dripping down their face, pretend blood. Again, with this, we see no lasting impact. And actually what we've seen is some of those kids who are at higher risk, who are, part of experiencing this mock car crash, actually we see that leads them to more risky behavior. So again, this can be a well-liked strategy amongst the community because it's very eye-catching. It often ends up on the front page of the newspapers. So prevention programs feel really good about it because they're getting media coverage about it. But if we're looking at the preventive effect of a strategy, mock car crashes does not do it. And last on this slide, drunk goggles. So these are the goggles, if you aren't familiar with it, that you can put on, and then it simulates what it's like to be driving under the influence. And often what they'll do is they'll put the goggles on and they'll be in a gym, and those little scooters that you can be on, they'll put kids on the scooters with the goggles on and then have them go through an obstacle course. Well, guess what happens with this? They find it fun, that this is fun to do this and watch your friends crash and do different things. And so this is another one of those that we do not see a preventative effect from it. And in fact, some cases, it can be like, wow, that's a lot of fun. So this is not a preventive effect. All right, so those are some education strategies that we've seen are not effective. Let's look at effective. So again, these are a few suggestions. This is not an exhaustive list, and it's more categories of the strategies. But things like social and emotional learning curricula in schools, we've seen have been effective in substance misuse prevention. Parenting programs focused on talking with and supporting youth. So those kind of parenting programs that really look at how do we create the communication channels between parents and youth and in constructive ways. Curricula proven to address risk and protective factors. So those curricula that reduce what we know are risk factors that increase the likelihood of substance misuse, as well as they also increase the protective factors. Age-appropriate information delivered over time. We know that the one-time deals do not work. And that's why if you look back to the ineffective slide, we'll see a lot of those are one-time kind of things. The assemblies, the drunk goggles, the mock car crashes, those are one-time events. And we know that one-time events doesn't do it. Long-term education campaigns with a focused goal and audience. So again, something over time, but also with very focused goals as well as audiences. So with these kind of ones, if you're thinking about this list here, they might not be real exciting kind of things that be that people are like, oh yeah, let's rally around these things. It sounds so fun and exciting, and we're going to get front page coverage on our local newspaper. But by implementing these kinds of strategies, we're going to exponentially increase the likelihood of actually having the impact that we are wanting to see in prevention. All right, any questions about the education strategies before I move into the next category? Anybody? How about across, let's see, Amber, how about across of both types of strategies? I'm not quite sure what you're asking, Amber. If you're able to unmute, feel free to ask me, or if you want to put more in the chat.
Like, I guess for me, I'm thinking like we have a program in one of our schools that is like not even once. And so like it's over a period of time, but in each session, not in each session, but in some of the sessions, they have people come in and do personal testimonies. So it's like it's not just somebody giving a personal testimony, but it's like an education piece along with that personal testimony.
Yeah, I think in that case, it's still, I wouldn't have, I would say it still would not be effective to bring in the personal testimonies. So if thinking about a way, and I'll go to you, Sarah, if thinking about, okay, instead of those personal testimonies, are there other things that you could bring in that have been shown to be effective? And Sarah, it sounds like, it looks like you might have an idea as well.
Well, I just wanted you to know, Chris, that in New Jersey, this program, Not Even Once, is something that's supported by the prosecutors and the police chiefs and the attorney general of the state. And so it's a curriculum that they wrote. So it is widely across the state, but through the police department. And that's the program you mean, right, Amber?
Yes, that's the program I'm talking about.
Right, so we are not going to have any impact on those testimonials because that's a curriculum we did not design. But it's important for us to understand that that part is not really that effective, and that for our own programming, we are not going to do that type of prevention. So we all know this is all a very complex thing.
And it is really hard because a lot of these things are entrenched in what we have done for years and years, as well as, like Sarah, like you said, they create this curriculum again for very good intent and purposes. It's not like they're thinking that I want to go in and do something that's not effective. No, it's that we feel and believe that this is effective. But unfortunately, what we're finding through research and through the evaluations that these aren't effective, but it can be so hard because then also you have these partners, like, Sarah, in this case, these partners who are wanting to be a part of this and do this. So these are things that we won't necessarily change, next month, maybe even next year, maybe some of these things are going to take some time to work with our partners and really maybe start moving in a different direction? Yeah, great question, Amber. Thank you. And thank you, Sarah. All right. Any other questions about the education strategies? All right, let's move to the next category, media strategies. Ineffective media strategies. So this probably isn't a surprise to many of you, but the fear arousal, scare tactics kind of strategies have shown to not be effective. This was even back to my days as a kid of, this is your brain on drugs with the cracked eggs. I don't know if any of you remember that, or if I'm aging myself. But, that was many years ago, and we are still seeing people use them though. So like recently there was a state that had a meth prevention campaign that used like the grotesque pictures of people who have been impacted by meth. I mean, they were real pictures, but and very sad to see. But again, it's those pictures, those kind of scare tactics that kids in their mind, they're like, well, that would never be me. Or I know somebody who used whatever drug it might be for that campaign, and they don't look like that. So it completely then they would disregard everything, all the information in that campaign. So the fear arousal, scare tactics kind of information has not been shown to be effective. The second piece here, reinforcing exaggerated substance use norms. So what we're talking about with that, and I tried to figure out a way to rephrase that, but I couldn't quite find a succinct way to say it. But it's the kind of thing where in your community, for example, let's say that you have had 1% 30-day use of a certain drug. And then you saw in the next year a 2% use of 30-day use of that drug. Well, theoretically, you could say in a media campaign, we've had 100% increase in use in this drug. Well, we're still just going from 1% to 2%, something to note, but by saying we've had 100% increase in use, it's exaggerating, again, the norms in your community. It's not that 90% of people in your community are using that drug. You've gone from 1% to 2%. So again, by exaggerating these substance use norms, you're going to lose credibility within your community of the things that you're saying, of all the things around prevention. So not effective fear arousal, scare tactics, as well as reinforcing exaggerated substance use norms. Let's look at some effective strategies. So some effective strategies within media include normative messages regarding peer use and action. So these are the positive social norming kind of campaigns. So for example, this is a screenshot of one of them of, I make my own choices. I like not drinking till I'm older. That's a choice for me. Often these kind of campaigns will say like 90% of so-and-so's high school students don't use whatever. Those kind of things where by seeing those messages, kids are thinking, they will think by not using, they are going to be in the majority of kids. So they are going to be, what am I trying to say? I'm losing the words here. They are going to be there with their youth. They are not going to stand out. They're going to be a part of the majority, which most kids, not all kids, most kids want to be. So the normative messages regarding peer use and actions can be very helpful. Lots of those campaigns are focused on high school students, as well as many research studies have been done in college students and have found that to be effective. Other strategies in terms of effective media is the positive effects of no use. So by not using, what good things happen. So again, moving towards those positive messages and moving towards the benefits of not using. All right, any questions about media strategies before we're going to move into our next pop quiz after this? Any questions? All right, Kai, let's go ahead and do the next pop quiz then. Here we go. So for each of these strategies, mark whether or not they are effective or ineffective, what research has shown. Give you about a minute to do this. And be sure to scroll down to see there's 5 of them. All right, with most people, give about 10 more seconds. All right, Kai, if you can go ahead and end the poll and share the results. All right, let's see how we did. All right, for the first one, mock car crashes have been shown to be ineffective. That's correct. Social and emotional learning curricula have been shown to be effective. Nicely done. School assemblies focused on dangers of using drugs. Again, good job, ineffective. Research has shown. Media campaigns highlighting a significant increase in youth cannabis use. So few folks wondering if it was effective, but for the most part, you all got that correct, that it's ineffective. And again, it's that piece that media campaigns focusing on significant increase in use. Those are the key words where we don't want to get into reinforcing exaggerated norms. Also, again, with the media piece, we're seeing that the most effective is by focusing more on the positive pieces of like if a media campaign highlighted how many youth did not use cannabis use. So showing the positive parts. All right, and last but not least, age-appropriate curricula focus on reducing risk factors and increasing protective factors. You all got it, 100%. Nicely done. Thank you so much for participating in this. Great job. All right, let's move into the next category of information sharing. All right. Knowledge-based interventions. This is so much of what we have done in prevention has really focused on knowledge-based interventions. Again, feeling like and believing that if kids just know what can happen, they won't do it. But in this case, things like the drug fact sheets or the effects of drugs of like, if you take this drug, you know, that's going to make you sleepy. It's going to make you not be able to sleep. It's going to cause weight loss, those kind of things. What we see with these knowledge-based interventions is we actually see an increase in use. Because what happens is kids are like, oh, that drug, my grandma has that drug or uses that drug. It's in her medicine cabinet. Huh, I could try that out. Or gosh, really, I want to lose weight. I'm going to go try that. Or gosh, I can't sleep very well. I'm going to, you know, so those kind of things. So what we have found is that knowledge-based interventions, providing that information is not an effective strategy. Myth busting, the other one listed here. This is an interesting one. This was a surprise to me when we first were pulling together information on this, on ineffective strategies. What we find with myth busting is there's something called the illusion of truth effect. And I'm going to kind of read this to you because I like the way it's phrased in terms of what is this illusion of truth effect. What it is commonly held beliefs and repeated statements are easier for the brain to process and are therefore perceived to be more truthful than the new information. So it's kind of like, okay, what our brain is used to, that information, that the myths are more easily processed than the new information. So it's much better to just put the truth out there and not put the myth with it because you're going to reinforce that myth piece. So I know we do it so much in our society of the myth and truth kind of thing. And even, you know, looking at some examples of what people are doing, often the myth is in big, bold letters, you know, like, and it stands out. And then the truth is written in multiple paragraphs. Again, so with, our minds and our brains processing, it's the big, bold information that's often remembered. So myth busting is not an effective strategy for substance misuse prevention. Let's look at some effective strategies for information dissemination. Again, we're going back to education related to risk and protective factors. So if the information is really focused on reducing those risk factors and increasing the protective factors, that can be effective. And action-focused information. So an example I like to think about with action-focused information is, let's say that you are working on preventing driving under the influence. And you're handing out, so this really thinking about maybe like a young adult kind of population, maybe 21, 25, or even older. Providing materials with information of how people can actually prevent themselves from driving under the influence or being in a car with somebody driving under the influence. So it could be providing materials with phone numbers for car services and taxis. It could be providing talking points for how to talk with friends about designated drivers, the importance of it and how you could do it. It could be providing a script for if you find yourself in a situation where somebody's wanting to drive and they're under the influence. What do you do? What do you say? How do you keep your friendship but yet say, no, we aren't going to do this? So it's those kind of things where the information is how do you put the information of, there should be no driving under the influence, but what do you do about that? So that's an example of action-focused information. Any questions about the information category? All right, let's move into environmental strategies. So environmental strategies, many of you are probably familiar with, if not all of you, but these are the strategies that we put into place to impact the environment in which we live. So what things are happening in our environment, in our community, in the broader areas. So not just looking at the individual, but what's going on around us. What kind of things can we put into place that will reduce the likelihood of substance misuse? So we know there's many, many, many effective environmental strategies, but there are a few that we want to avoid if we're looking at substance misuse prevention. What we see, and these are school-based environmental strategies in this situation, that punitive approaches and zero tolerance approaches have been shown to not be effective with substance misuse prevention. So punitive approaches are if you're, for example, caught vaping, smoking, using alcohol, etc., that there is a harsh consequence, typically a harsh consequence to those kinds of things, to those, having used. Zero tolerance is the situation of you're caught once and, for example, you are automatically suspended, those kind of things. And what we're seeing that within these two strategies, and the research is often focused on both of those, so that I'm lumping these two together. But what can happen with these kinds of approaches is it can actually increase the likelihood of substance misuse. And that's because, for example, if kids are suspended for having used or other things, then guess what? They aren't in school where they can be monitored, where they could have assistance in terms of what's going on in their life. Instead, they are out. They may not be monitored, very likely not monitored at home because parents often will be working. And guess who they end up hanging around with? The other kids who have been suspended. So what we see is that by having these punitive or zero tolerance approaches, we are seeing an increase in the risk factors in those kids' lives, a decrease in the protective factors that are around them, and also that these approaches don't provide instructional or rehabilitative opportunities. So there's not an opportunity through this to help correct or address. That's the word I was looking for. Help address the issues that ended them up in these situations in the first place. So let's look at some environmental strategies that are effective. There's a bunch of them. Here's a few examples. We know things like advertising restrictions, changing hours and days of sales of alcohol and tobacco, changing conditions of availability, things like compliance checks, economic interventions. We know we're raising the cost of something, of alcohol and tobacco, through taxation is usually how it's done. We see a decrease in use. Social host ordinances. These are just a few examples of effective environmental strategies. Any questions about these before we go into our last pop quiz? Anyone? All right, let's do our last pop quiz. Kai, if you don't mind pulling that up. All right, and be sure to scroll down again. There's 4 questions this time. Effective or ineffective? Wait, about 30 more seconds. Ten more seconds. All right, Kai, if you could go ahead and end the poll and share the results. All right, let's see how well I did at imparting this information to you all. All right, first one, normative messages regarding peer use. Yes, effective. That's been shown effective. Reducing the availability of alcohol and tobacco. Yes, absolutely effective. That's by reducing the availability, the less accessible it is, the less likely that it will be used in terms of youth alcohol prevention. And then myth busting, that is correct. Well done. Ineffective. It's not, instead of, we end up reinforcing the myths instead of really focusing on the truth. Zero tolerance policies. Well done. Ineffective. Nice. Well done, everybody. Go ahead and stop sharing that. All right. The last category that I want to talk about in terms of ineffective and effective is a little bit different. And this is more looking at the components of the strategies of different programs. So a little bit different take of a different angle of what we've been looking at. So ineffective program components or characteristics. We see that within parenting education kind of programs or caregiver education programs, that if we're focused only on the parents and we don't have a component that pulls in the youth, that is not as effective. We also know that didactic delivery methods, in terms of just the one-way information standing up in front of kids, so this is kind of the assembly kind of method, or even a classroom kind of method, that just sharing the didactic approach is not effective. Developmentally inappropriate for the population, probably again, no surprise, but if we're looking at elementary age kids, we're going to share and work with them on very different information than we would with the high school kids or even the middle school kids. And the last component that has been shown to be ineffective is grouping together youth at high risk. And this is something that can happen, especially if you're working on indicated prevention programs, that sometimes kids who are at higher risk and have higher risk behaviors are put together in a program. What we're finding then is, guess what? The culture or the norm of that group is high risk, and it's high risk behaviors, and they tend to feed off of one another. So grouping together youth at high risks has not been shown to be effective. Some effective components. These include things like building social and personal skills. So that's that social and emotional skills component. Citing immediate consequences. So it's things like in tobacco prevention programs, we may talk about, in curricula or strategies, we might talk about how tobacco can cause, or your smoking can cause lung cancer. Well, again, kids are like, well, yeah, that's 50 years down the road. I'm not going to worry about that. But things like talking about you're going to have bad breath. Yeah, people are not going to want to be around you because your clothes are going to smell. Things like that, the immediate consequences are going to carry much more weight with kids. Communicating positive peer norms and correcting misperceptions, that's that social norming component that we talked about with media strategies, that has much more impact in terms of preventive impact. Involving youth with peer-led components, peer-to-peer learning, if it can be done well with effective ways, with effective strategies, can be very helpful and effective. And finally, using interactive approaches that include skill practice. So again, not that didactic approach, but instead, how can you take the information that you're wanting to do the skill building, like the social and personal skills building, and creating that interactive approaches where they can really test out and practice using those skills. All right, I've thrown a lot at you. Any questions before we talk about how moving our communities forward from ineffective strategies to more effective strategies? Any questions? All right, let's go ahead and move on then. So moving forward, what can we do? My guess is probably each of you have identified at least one strategy that I've talked about that science and research has shown to not be effective. What do we do with that? How do we move forward? What's going on in our communities that makes us continue to use ineffective strategies? So I'd be curious if you put in the chat of any ideas you have about why do we continue to use ineffective strategies if we have this information showing it's not effective? What's going on in our communities that can cause us to do that? Love for anybody to come off of mute or put in the chat your thoughts. What do you think? Why do we use ineffective strategies?
So I think like Claire put in the chat, because it feels like it should work. Like that is a big reason for a lot of them. Like, and I guess for me, the way I look at it, and when we first talked about it in the last meetings that we were doing, was we're thinking about it from an adult brain. And I think that makes a big difference too, is not understanding, like, as teens, like we were all teens once, but sometimes we forget that what was effective for us when we were teens, and asking them what it is that works makes a difference.
Absolutely. Well said. Absolutely. Yes. And Sarah, did you have a thought too?
Just wanted to say that sometimes prevention groups here, I'm sure everywhere, really love the programs they've run in the past, and they have that good feeling, like that every 15 minutes car crash event every spring really is impactful because they feel good about running it. And it's important for us to be doing education with them so they understand that it's not having the outcomes that they hope it has. It's hard.
Exactly.
It's hard. I'm not saying it's not hard. It is hard.
It's yeah. And I absolutely am not saying that it's easy to move folks forward from these kind of things. And yes, and that's Erin Ficker, who you might know. Her favorite saying is, "I really like cookies, but just because I like them doesn't make them good for me." And that's the same kind of things with these strategies, that we may really like them and there are things we really love about doing them, but just because we love them doesn't make them effective, unfortunately. Yeah. Yeah. And Radiant says in here, because it may have worked with past generations. Yeah. Maybe when we were kids. And this is something, actually, I'm glad you brought this up, Radiance, because there are often times that as prevention professionals or those who are working in prevention efforts, we will remember back to a message that we got during school, like, and it may be from a school assembly that we're convinced made the difference in terms of whether or not we were we decided to use alcohol or other drugs. But the reality is that there was probably much, much more going on in your life, when you were a kid, when you were in high school or middle school, whenever you heard that message, in terms of what risk factors did you have around you? Perhaps you were in a lower level of risk factors in your environment, and you might have had a lot of protective factors going on. So if you had that low level of risk and high level of protective factors, and you're hearing this message in, for example, a school assembly, yeah, it might have sunk in great, but the reality is you might have been fine anyway, right? So we think back to these things and we feel like they can be monumental things that happen in our life, but that may not have been the key piece. So Radiance, thank you for bringing that up.
You're welcome. I agree with you as well. Yes.
Great. Okay. And let's see, Claire says it feels like there's a trade-off between getting and keeping community support and moving into new interventions. Losing community support is not something that is wanted. Absolutely. And that's where it's, moving people slowly towards the more effective strategies, getting this information out there in terms of what we know through research does and doesn't work. Because again, I know in my heart of heart that people are doing this because they want to make a positive impact. So being able to gently, guide and provide more information to folks of, how can we be more effective? So I'm going to share a few more things on the slide here that I think we've already said in some cases. So perception that interventions are liked, we talked about. Partners may not be open to change. So there are like the curriculum that Sarah and Amber, I believe, mentioned earlier, that it could be that our partners are very invested in a certain program or curriculum and feel like it's the correct thing to do and the effective thing to do. So that can be very challenging. Partners insist on implementing despite the evidence. That can happen. Individuals feel the strategy worked for me. That's what Patience and I were talking about a little bit. And then a concern for capacity and or cost. This often becomes a huge thing. For example, with drunk goggles, what I've heard from communities is that they are quite expensive. And so I heard from talking with one community, they'd spent $8,000 on these drunk goggles. And so then even though they heard that they aren't effective, people who or the funders are like, well, you have to keep using them because we put all this money into it. So that can be very challenging to say, okay, yeah, basically we made a mistake, but let's not keep moving forward. And things like assemblies can be very low cost for you get hundreds of kids in one classroom with one speaker all done at once. But again, if we're looking towards are we effective or not, unfortunately, will increase in capacity and at times increased costs can be important to put into it. All right, so thinking about the bottom line here, the bottom line is that if the ladder is not leaning against the right wall, every step we take just gets us to the wrong place faster. So let's not lean our ladders against the ineffective strategies, and thinking that if we can, if we just keep doing that enough, it will be the right place. It's not going to be the right place. Let's find those effective strategies and move towards those. Start leaning our ladders against those walls in order to move towards more effectiveness. So if you're interested in putting some of this information into action, and what I encourage folks to do is within the next 24 hours at the most, take action on this information because we are living such busy lives. We get so much information coming in. If we don't do something with it right away, we're going to forget it. We know through research that even an hour from now, you will have forgotten 50% of what I have said. So that's our brain. That's just what the capacity is. The more things are coming in, some things have to go out. So if you want to solidify this information and put it into action, here's some ideas from me. Have a water cooler chat. be it virtual or not, with a colleague about this webinar. If you share information with somebody else, that is going to reinforce your learning right away and it helps solidify it. Read what research shows does not work in substance misuse prevention. This is the literature review that all of the citations on the ineffective slides where it came from. So if you're wanting more information about any of these things, that's where you will find it. Review the strategies that you are implementing regarding the evidence of effectiveness. So taking a close look at what are you working on and are they falling in the effective or ineffective categories? Explore the online registries of effective prevention strategies. So if you're wanting more ideas for what research has shown is effective, there's this great document from the Pacific Southwest Prevention Technology Transfer Center where they have information a bit about the different online registries of effective prevention strategies and how to get there, what information they have, etc. Create a plan for your community to move from ineffective strategy to an effective one. So like, how can you start taking even baby steps, moving people towards that? So I would love for you, if you're willing, to put in the chat what you might be willing to do, or not might be, but what are you committing to doing within the next 24 hours? Anybody willing to commit to anything? I'd love for you to put it in the chat. And as we do that, there is in the next slide, here's some additional resources that you will be able to get. Claire put in there that you will get these slides so you can look at them. Thank you, Dawn, for committing to an action. All right, and Sarah, thank you. And I'm going to go back to here. Anybody else? And as you are putting that in the chat, I'm going to turn it over to Claire to wrap this up.
Well, thank you so much, Chris. This was such a great session. Thank you, all of you, for participating. It makes for such a richer experience. We're going to close the room in just a moment, and I'll just share with all of you. I will send out the slides within the next hour. And if there is anything in here or in those resources, like if you can't access any of the resources, it's like you can't click. If you need anything else about this, just let me know and we will get it to you. You'll have my email when I send out the slides and your certificates of attendance. So just a big thank you to Chris and to Rebecca and to Sarah for letting us be here with you.